So I think the big challenge for coming up with vaccines for infectious diseases is that the primary buyer of vaccines is governments, and they need to create the pull or the demand for that. So if pharmaceutical firms know that the governments would give a good price for the vaccines, which would justify the R&D into the vaccines, then they are more likely to invest in it. So I think the government will have to give a commitment to buy the vaccines at a certain price based on parameters about how effective the vaccine is or how safe the vaccine is. The second thing the government can do is give incentives for R&D. So if you invest in clinical research or preclinical research for infectious disease vaccines, the government should subsidize that research or incentivize that research, and that will help pharmaceutical firms to put in more investment in R&D for vaccines. So I think those two things, creating a demand or a pull mechanism by guaranteeing a certain amount of purchase at a certain price, and the push mechanism is providing incentives for R&D. Those two things can help. And then easing the regulatory burden, making the process of getting the vaccine approved within the country, having clear guidelines for the clinical trials, that would help speed up the R&D process and speed up the process from kind of the lab to the actual introduction of the product in the market that can help.